coming to the next topic, that is the reproductive physiology. Let's solve few previous year MCQs. Coming to the first question, that is, which of the following is seen in the ovulatory phase? See, stimulation of continuation of the reduction division. What it means? That, see, continuation of the reduction division of oocytes. That means resumption of meiosis. Okay, so in ovulatory phase, there occurs resumption of meiosis for which ovulation occurs. So this is the correct answer. In ovarian cycle, increased level of LH are due to, see, in the ovarian cycle, increased level of LH is due to, that means LH surge. So before LH surge, there is increased level of E2 or estradiol. So the answer is increased estrogen. Okay. Then coming to the third question, in 40 days of menstrual cycle, the ovulation occurs at. So the menstrual cycle duration, day of ovulation, what is day of ovulation? Menstrual cycle minus 14. So that means 40 minus 14, that means 26th day. So what is the answer? 26th day. Then the ovarian cycle is initiated by, see, ovarian cycle is initiated when there is development of the follicles. So when does follicles are developed? When there is increased level of FSH. So when HPO axis is activated, there occurs increased level of FSH or increased release of FSH, and then there is development of the follicles and ovarian cycle is initiated. So answer is A, option A, that is FSH. The corpus luteum secretes, C, corpus luteum secretes progesterone as well as it also secretes estrogen, relaxin and inhibin. So the answer will be both estrogen and progesterone. Okay. Then coming to the sixth question, that is, endometrial cell apoptosis occurs by change in the hormonal levels. When there is no fertilization, the endometrial cells dies by. That means endometrial cells dies. What happens? There occurs menstruation. So indirectly the question is, it is asking that what happens, what are the physiological changes that happens that leads to menstruation. That means there is withdrawal of the progesterone and estrogen. So the involution of the corpus luteum, that leads to decreased estrogen and progesterone, that leads to withdrawal bleeding or apoptosis of the endometrial cells, as the cells could not be supplied by the progesterone. Okay. Then coming to the next question, corpus luteum functions maximally without implantation for, that is, average 6 to 9 days. 7 to 9 days. Okay, so answer is 9. Then maximum function of the corpus luteum occurs, see, 7 days after ovulation. I've told you just now, right ovary ovulates more than left, which is not a reason. See, this one is a study. Okay, so that affects both anatomy is involved, then blood supply is involved, and embryology is involved. Right-handedness is not, this is not involved. So answer is A. See, these are correct answers. So which is not a reason? Option is C. That is, right-handedness is more common. That is not the answer. Then ovulation occurs. Ovulation occurs. See, does ovulation occurs before LH surge? No. After LH surge, ovulation occurs. After biphasic rise in body temperature? No. After follicle ripening by the FSH? Yes. And before estrogen peak? No. After estrogen peak and after LH surge. So this is not the answer. Then coming to the next question. True about timing of LH surge. This occurs, I have told you, 32 to 36 hours. Okay. Before ovulation. Also answer can be 24 to 36 hours before ovulation. precise is this one, but if the option is not given, you can write 24 to 36 hours. So the answer is option B, that is 24 hours before ovulation, which is not related to menstrual cycle. Hormonal changes, yes, it is related. Hormonal changes are related. Vaginal cytology, it is also related. Endometrial sampling, it is also related to menstrual cycle. So estrous cycle is not related. Okay. Then true about ovulation and menstruation. See, this is PGI question, so multiple choice will be correct. So temperature decreases at ovulation? No, temperature increases. So this is false. Estrogen increase in proliferative phase? Yes, this is true. And LH surge occurs before ovulation? Yes, this is also true. 80 ml of blood loss is normal? Yes, up to 80 ml blood loss is normal. Okay, more than 80 ml is called as heavy menstrual bleeding. So answer is true, B, C and D. Then true about ovulation and menstruation. Temperature decreases at ovulation? No, temperature increases. So this is false. This is also a PGI question. Estrogen increase in proliferative. Say this one is a repeat question. Okay, as above, I've told you the answer. Then hormone levels estimated on ovulation day shows. See, on the ovulation day, I've told you about the hormonal changes in the video in details. So just go thoroughly about that. That at the ovulation day, there will be increase in FSH, increase in LH, as well as the estrogen will be at peak, and there will be increasing level of progesterone. So all the hormones will be increasing levels. Okay. Then naturally occurring estrogens are E1, E2 and E3. E1, E2 and E3, that is estrone, estradiol and estriol. So estrone, estradiol and estriol, these are the naturally occurring estrogens and not DS or diethylstilbestrol. Then coming to the next question, cervical mucus production is stimulated by, it is stimulated by estradiol, and also fardening occurs due to estrogen. So two questions are solved here. Then infertile women with proliferative endometrium, what is the preferred hormone? See, if infertile women and in post ovulation, we are seeing that actually the endometrium should be secretory, but here what we are seeing, that the endometrium is proliferative, but here in this case it is proliferative. That means there is lack of progesterone. Okay, that means there is lack of progesterone. So the treatment is, what is the preferred hormone in the next cycle? We will give progesterone. Okay, so see, this one is medroxyprogesterone acetate, MDPA. This is also progesterone, desogestrel and norethistron. These are also progesterone. But what is the progesterone drug of choice? See, these drugs, the that progesterone that have minimum anti-ovulatory effect, because we need ovulation. The patient is infertile and we need ovulation so that the patient can conceive in the next cycle. So the progesterone that have minimum anti-ovulatory effect, we will give it. So the answer is medroxyprogesterone acetate and not desogestrel or norethistron. Okay. Then coming to the last question, end product of progesterone metabolism in urine, that is pregnanediol. Okay, the progesterone is metabolized and it is secreted in urine as pregnanediol. Okay, so keep learning. Thank you.